Hey, welcome to Simple OT. Today we'll be talking about return to work. So let's start out with workers' compensation. Workers' comp is state dependent and it often requires authorization by a case manager before services are delivered. So let's say a patient comes to you, they injured themselves on the job, they have workers' comp. You're going to need approval prior to treating them. You'll often have to contact a case manager to identify services that are covered to get pre-approval for your treatment sessions together. It's also important to note that to decline a patient because they have workers' comp actually violates the code of ethics. You definitely want to see these people, even though it might be a little bit more work than other benefits or resources. There are two primary approaches. First of all, work hardening is a multidisciplinary approach with the goal of return to work at full or modified duty. Multidisciplinary approach focuses on multiple factors. So we might see a patient for biomechanics or neuromuscular needs. They also might have like a psychologist or mental health professional on their team, someone to review psych, behavior, social needs, as well as perhaps safety, or we're also going to look at physical tolerance and productivity. So all of these things can be targeted with a team of professionals. Accreditation is required for this one, and I remember it as the phrase work harder with work hardening because it's a bit more intense than work conditioning and often comes after work conditioning as a way to fine-tune skills. So for work conditioning, it's one discipline that aims to restore flexibility, strength, mobility, and endurance in a patient. For example, it may precede work hardening and might be the first step in the process towards recovery. And I remember this as work conditioning, work one-ditioning. If you pretend, it kind of rhymes, and it can be a way to remember that there's only one discipline with work conditioning. So some similarities between the two are that they both treat strengths and client factors, and they're going to offer work simulations, and they both aim to progress patients. Work hardening is a bit more intense, as you can see. It is up to 8 hours a day for 5 days a week. I think of work hardening as task replication, like fine-tuning of tasks or performance skills, and then work conditioning more so just generally restores function in my brain. That is how I understand it. So functional capacity evaluations are the core of all of this. They are objective assessments of a patient's ability to work. So this might include medical record review, interviews, as well as assessment of like musculoskeletal functioning. There's also assessment of pain, and then standardized tests for physical performance. The purpose here is to determine work-related disability, severity, or status. So it's not necessarily OT specific, but it can be completed by other professionals as well. And if the patient has not worked, let's say they're really young, they're coming out of school, maybe they have a disability and they're interested in obtaining a job, these are some resources that they can use. So you might offer a vocational evaluation in this case where the patient has the ability and the desire to work, and we're essentially going to evaluate their interests and their limitations for work. You could also consider a vocational rehab program. This rehab program helps people prepare for, obtain, and maintain a job. To me, that sounds very much so like a rehab program. Preparing for, working towards, and sustaining something is very rehabilitative in my mind, so the name is very appropriate. There's also transitional programs, and this happens inside of the work environment where the patient can't really do all of their job demands, and so the job demands or the specific tasks of a job actually become the intervention or the means to an end. For job coaching, this can also occur in the work environment. and it essentially involves the determination of a patient's strengths and challenges through multiple means, so interviews, observations, activity analysis, and goals will actually be created here to help motivate the patient at work. So how can we prevent injuries in the workplace? There are 3 prevention strategies often talked about in the public health world, but they're certainly something that we go over in occupational therapy as well. So for primary prevention strategies, the main purpose is to identify and reduce risk before they happen. So here you might see people push wellness, and try to stop things before they happen. In secondary prevention strategies, we're going to identify symptoms early and reduce the severity of those symptoms during an injury or illness. Tertiary prevention strategies include treating the injury and restoring the individual or restoring their role after an injury, illness, or disability. So my brain automatically connected this to COVID-19 pandemic. I thought of the primary level as masking, where people who aren't sick were asked to wear masks out in public to avoid spreading or contracting COVID. Secondary, I thought of quarantining, where people who are currently sick actually are able to reduce the risk of spreading the disease to others by isolating. So you're doing some damage control here. And then tertiary level, I immediately thought of providing medication to COVID patients to reduce length of infection so that they can get back to their lives. So they've already got it, and now we're going to try to reduce it and move forward, get back to normal life. If that doesn't make sense in your brain, there's also a hospital fire example. So first, the first line of defense is going to be to educate all employees on fire safety and fire hazards. The second line of defense might be those hallway doors that automatically close when fire alarms go off to help reduce the spread of the fire. The people in the area evacuate, and there can even be sprinkler systems that initiate to reduce the spread of the fire. And then lastly, firefighters come in and put the fire out, and the hospital will rebuild and possibly rebuild with less flammable materials as soon as possible. So you can see that we go from everyone's involved, we're gonna spread the information to everyone unspecifically, just the general public, to help prevent something. And then we go on to kind of minimizing what we can, controlling what we can, control the symptoms, control the situation. And then lastly, we help the situation resolve or help the patient move forward and return to life as they knew it through remediation or adaptation.